Welcome to BW Conversations. Today we're talking to Alok Awasthi, the founder of SeekMed, the telemedicine platform, about the rise in telemedicine, how we can keep this rise going, and the National Digital Health Mission. Welcome, Alok.
Thank you, Jyotsna.
So my first question to you, what are the key aspects to be kept in mind for the National Digital Health Mission to be a success?
The National Digital Health Mission that the Indian government has started, it's really a very unique initiative that has not been attempted by any government across the globe. I believe Sweden is probably the only government that has tried a national ID, a health ID. But the scale and the complexity within India is much more greater, and therefore the opportunities as well. The success of National Digital Health Mission, in my view, depends on bringing three pillars together, which is the patient, the provider, which is the doctor, and the payer, who has to pay for these medical healthcare facilities. And in order for all of these things to work, implementation is going to be the key. I understand that it was piloted in 6 states or 6 regions, and now it's being deployed across the globe, across all the states as part of the new budget. So how the government and policymakers implement the policies and how they take it to the individuals, patients, that is going to be the biggest challenge. The other success criteria depends on how we harness the data. As you probably know, that India is a vast country, and our health burden or the disease burden varies from state to state. So certain states have higher cardiovascular or cancer burden compared to others. So the data gets generated out of NHDM will allow our policymakers to apply those specific implementation plans rather than doing it across the board without looking at that in mind. So it's part reaching out to the patient community, and it's part harnessing the data to better implement the NHDM policies.
What about privacy? Could that be an issue, considering that there's so much data for everybody that we'll sort of be having?
Data privacy will continue to challenge all technology leaders and business leaders. And it's not just limited to NHDM or NDHM or other, but anyone who is playing a part in this digital health. A lot of data is generated as part of electronic health records, as part of the medical records that patients generate and share with their providers. And many times, especially in developing countries, we don't hear much about data privacies. But keep in mind that India is also a prominent medical tourism destination. So many patients come to India from developed countries, and they feel very strongly about data privacy norms. We have some standards, global standards, in the form of HIPAA compliance in US. We have GDPR in Europe. The Indian government is working on a Privacy Act. So all of this needs to be looked at very carefully. And while we wait for Indian government to finalize the Disha Act, which is the Privacy Act, it is incumbent on technology leaders and business leaders to proactively look at data privacy norms and try to meet those global standards, because regulations generally follow technology. So from technology point of view, we need to be ready. And data privacy, I want to emphasize that it's not just about technology. It's also about the business processes. It's how the resources, the employees within these digital health companies interact and look at the data, because sometimes there's manual hand-holding of data. So how those internal processes are set up will decide how best we are able to overcome this challenge.
Telemedicine has really sort of in the last year has seen a lot of funding globally also, and when we look at India also. Do you think that it will continue now that everything will open up soon and we're thinking that things will get back to normal? And also, how do we keep that growth going?
So telemedicine saw tremendous growth last year as a result of COVID. So from funding point of view, globally, the digital health saw close to $15 billion of funding. Out of that, telemedicine was close to $4.5 billion, which is huge. The rest has been taken care of by data analytics and patient monitoring, practice management systems. We see that this trend is continuing forward in 21 as well. In fact, in these first 2 months, there's been a lot of activity around venture capital movement in this space. And this is going to continue as people start adopting telemedicine as a primary mode of communication with their doctors. Doctors are opening up. They have opened up a lot, which has helped in the adoption. Governments have eased regulations, especially in case of India. There was a gray area before the pandemic. They have eased the norms. And this has helped in the adoption. So now corporates, individuals, hospitals, clinicians, they are all coming to the same page with regard to telemedicine and looking at it as more favorable ways of imparting the healthcare. There is a study done in US where more than 93% of clinicians consider telemedicine as an acceptable form of communicating with their patients, and more than 66% were highly satisfied. And this is a very interesting and very favorable thing for telemedicine as a whole.
So my last question to you, tell me a little bit about SeekMed and the immediate plans that you have for SeekMed.
So SeekMed is a global telehealth platform which focuses on telemedicine and patient education. It connects patients worldwide with India's highly awarded and most admired doctors. Many of our doctors are Padma awardees, Dr. B.C. Roy awardees. Our philosophy is to empower patients so that they can take better control of their medical decisions. And we do that by bringing the best in technology and the best in medicine together. We want to bring early intervention of super specialists easier for these patients who are living in far off places. So people coming from Northeast states of Shillong, Meghalaya, or Port Blair, unless it is absolutely necessary, they can easily connect and consult with our top doctors. We are also very bullish on patient education. So in addition to affordability, accessibility, quality of care as the key impediments, which are generally talked about, we consider information as another key impediment. Despite having smartphones and 3G and 4G connections, many times patients don't have credible information and they get misguided. So our patient education health library is India's largest. It is one of the world's most comprehensive that provides credible medical content, patient education content on any medical condition that you can think of. This has been reviewed and approved by board-certified doctors in the US. And we believe that a well-informed patient can lead to better patient outcomes, can lead to better health outcomes. We are very bullish on that and will continue to invest on patient education. A well-informed patient can also ask better questions with the doctors, because it's a fact that doctors don't have a lot of time explaining to patients all the details about the medical condition. This health library also provides information on more than 33,000 medicines. So if you are taking a medication, you can visit our health library and see what else you should not be taking. Many times these kind of finer details are not discussed in the patient-doctor interactions.